And now it's your turn with our family physician, Dr. Elizabeth Vaughan. She's going to take your calls right now. Thanks so much for sticking around. And the web chat, you had great questions, I noticed. Very nice.
Absolutely.
Very nice. Let's get to the phones where we have Lynn from Pleasant Garden. Good morning, Lynn.
Good morning.
Good morning.
I have a question for you. My child is 7 years old. He has autism. He's mildly autistic, and if this new treatment will cure autism, I'm not saying cure, but help him along to where he's not crying saying my brain hurts, because he doesn't understand why he feels like he does and can't say what he needs to say. What can I do to follow through to find this treatment for him?
There is, if you call my office, I'll give you the name of a physician over in Winston-Salem that treats children that are 7 years old for autism. I frequently will do the testing for her to see if they do have mercury toxicity or not. Unfortunately, there are not that many physicians in this area who take care of children, and the state of North Carolina Board of Medicine does not encourage physicians to treat children for autism and to even look for mercury toxicity. That's got to change. There are people who have to go to Florida to get good treatment and to get chelation. But call my office and I can give you the name of a physician who can help you out.
Can you give her the number?
My office number is 808-3627.
808-3627. All right, let's go to Ray in Lexington. Good morning, Ray. What's your question?
Good morning. Thank you for my call.
Uh-huh.
How rare is it for twin 4-year-old girls to be autistic?
Now, that's relatively uncommon, but what that says is that it's not just, people think that it's just getting the various shots or it's just genetic. Are your children fraternal twins? I didn't ask. I should have clarified that. Probably, in all likelihood, the mommy actually had mercury toxicity, and mercury is concentrated across the placenta 1.7-fold. So children get exposed to much higher doses of mercury than their mommies do when they are in utero. So whenever I see two kids that have mercury toxicity, obviously if they have the same genes, that's going to increase their risk, and they had to be exposed to it in utero in all likelihood.
Let's go to Ann in Eden. Good morning, Ann.
Good morning.
Good morning.
I went out to put algicide in the pool. It shot up in my eye. I have washed it with solution for my contact lens. I've tried washing it with water. It's not excruciating pain now. It's not as red. Do I need to go to the doctor? Because when I read the bottle, it said it could do permanent damage. It didn't mention rinsing it. If it gets on your skin, you have to wash it with soap and water. I can't do my eye that way.
How long ago did you do this?
About an hour.
I would go ahead and I'd probably go ahead and see an ophthalmologist today or someone that can double check it. And I would go to the sink immediately and rinse 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 your eye. If you have any Johnson's baby shampoo, some of the No Tears shampoo, I would use some of that, because that you can use in your eye. But I'm not familiar with what's exactly an algicide, so I would go ahead and rinse it and follow up with a doctor's appointment without any question.
Let's go to Samantha in Greensboro. Good morning, Samantha. What's your question?
Good morning.
Good morning.
I can't help everybody notice that on TV there's so many commercials for men that have erectile dysfunction. I was wondering, what do they have on the market for women to help achieve orgasms?
Very good question. Some of the same drugs and some of the same treatments work for women also, because orgasms come from the same place for men and for women. Some physicians actually prescribe a very small dose of Viagra, Cialis, Levitra, all of those for women. That's especially helpful in women who are postmenopausal, not premenopausal. Using arginine, which is an amino acid, taking 750 milligrams of it at night and increasing it to 750 twice a day, helps also with erections. You can also use, I'm blanking on it, testosterone. Testosterone is critically important for both men and women to be able to achieve erections. So if you have problems with desire and not being able to have an orgasm, you may ask your doctor to use a topical testosterone in the genital area, and that will help over a period of a month or so.
But it's always good to open up a conversation with your doctor who can help you.
Absolutely.
All right.